Hello everybody, welcome back to another installment of our Psych Chat series. I'm Green Beauty and I'm going to be telling you a little bit about this topic. For those of you who are newer to my channel, welcome. Not too long ago, I started a little series called Psych Chats. I am a licensed psychotherapist, and so mental health is something that I practice in my career, so it's obviously something that I take very seriously and think that we need to be talking a lot more about it. And because of that, I decided to just do a little series called Psych Chats, and it became so popular. I was not expecting that response at all. In fact, doing another Psych Chat video is the #1 most requested video that I receive, which is interesting considering of all the sorts of role plays and things like that. So that means that there are lots of topics that can be covered. I sort of started off with more random ones because I was just testing the water. So like attachment styles in adulthood, that type of thing. Today we're going to be talking about anxiety disorders in adulthood. Now, this one was quite a challenge for me because anxiety is so vast, and for me to try to sit here and sum this up or give you some highlights in, let's say 30 minutes or less is quite a challenge. So, for today's video, the way I'm going to lay it out is I'm going to do a brief introduction on anxiety, which I'm sure when I say that word, all of us know, we have an idea of what anxiety is. So I will introduce anxiety. I will give some statistics around anxiety. Now, please keep in mind that the statistics for the anxiety disorders come from the USA. So unfortunately, I wasn't able to include any international statistics or anything in the UK, and that's because I needed to make this video as concise as possible. And if I was trying to include all sorts of different things, it would just become too lengthy. So please forgive me on that. Now, I will say this. If anxiety turns out to be really interesting to all of you, I'm sorry, my camera keeps focusing like that. If this topic becomes so interesting, and I get this response, I can break it up into smaller segments. So if something that I talk about is of particular interest, I can do a whole video on that and so forth, okay? So keeping that in mind, what I'm going to do is like I said, the introduction, the statistics, and then I'm going to define what the anxiety disorders are in adulthood, okay? So we're not talking about any anxiety disorders that occur during childhood. That's a whole other discussion that, again, it was too much to fit into one little video. So we're going to talk about anxiety disorders in adulthood, what they look like, symptoms of them, and how they differ among sex, so among men and women, and how it manifests, and sometimes how we develop these disorders. So we're going to get into some of that. I'll give you some examples to support and illustrate some points that I'm making, and then we're going to conclude by talking briefly about the most effective treatment for these disorders, okay? And this is evidence-based treatment, which that type of treatment has been proven to be the most productive and effective for anxiety disorders. So that's how we will conclude the video. Please look in the description box and you'll find all my sources. You'll find lots of information on what to do or where to look if you yourself are struggling with anxiety. And before I even get into this, I know that I stated I am a licensed clinician, but please know that this is not a substitute for mental health treatment. If you are in need of any type of counseling or you're in crisis, please call your local emergency number number, or you can visit the resources in the description box for mental health support. Okay. So getting into anxiety. So anxiety has become the #1 mental health issue in North America. Okay, the #1 mental health condition, the #1 concern and issue. It's estimated that about 1/3 of North American adult population experiences anxiety. Now, let's keep in mind that anxiety is a broad term, and even though I will be defining specific anxiety disorders, I want to normalize this sensation of anxiety in all of us. So whether or not you fit the criteria for a specific anxiety disorder, all of us will experience anxiety at one point or another in life. It is part of the human condition. It is one of the fundamental emotional experiences due to our brain chemistry, our cortisol, and our adrenaline. We are hardwired to experience that sensation of anxiety. Now, all of us will have periods where this might spike up. Sometimes it might come with the loss of a loved one or a huge transition in life like a divorce or buying a home or anything like that if your job is overwhelming. So having bouts of anxiety or isolated experiences with anxiety is normal. So please know that moving forward. And as we get further in, you'll start to see the specific criteria that's required for us to have an anxiety disorder. So approximately 30% of the adult population in North America have an anxiety disorder. So 1/3 or 30%, okay? And only 1/3 of that 30% will receive treatment. And of those, only 10% will receive proper treatment. Okay, this is huge. Only 10% receive proper treatment. And there's multitude of reasons for that. The most effective treatment or therapy styles for anxiety will be talked about at the end of this video. And I will go into why those are most effective. And they are not just your general talk therapy. They are not your general sort of just reflective and interpersonal exchange with your therapist. They're very specific. So I'll get into that. It's also important to know that those of us who experience anxiety have a really high propensity for drug abuse and addiction and alcohol and drug use, okay? This is really, really, really common. And in fact, I would argue that every single person who has an addiction or has some issues with substance misuse there's an underlying probably anxiety or depression going on, if not something more severe. But it's often our mental distress that lead us into addiction, okay? Again, that's a whole other video that I don't have time to get to. But I wanted to note that because I want you, or I encourage you, to reflect on your own substance or alcohol use when talking about these things and think about, is it that I need to have a drink every time I go out? Why is that? Why can't I be in a public place without having a beer or a cocktail? Just something to think about. Okay, so over the last 10 years, 54% of women and 46% of men experience anxiety. So this statistics come from over the last 10 years. 54% of women, so more than half of women. Okay, we've got a lot to think about there. Why is it that more than half of women experience anxiety? We can talk all about social factors that might contribute, or gender norm and expectations that might contribute as well, or motherhood and the double shift expectation of working and taking care of children, right? We have all sorts of reasons why that might be. And then we have 46% of men. Now that's really high too. That is almost half. So it's not uncommon for someone who experiences anxiety to also experience depression, or vice versa. You will often find they are hand in hand. For example, let's say somebody has panic disorder, which we're going to get to in a few minutes, and they have a horrible panic attack, and again, they can't go do the activity they need to go do, and so they stay home. That then leads to maybe a little depressive episode because look at me, I can't go do this, I'm so stuck in my head, etc. So they play into each other quite a bit, and that's why you'll find that many SSRI medications, okay, the serotonin reuptake inhibitor pills that we use, the antidepressants, those meds usually address both anxiety and depression. Okay. So I want you to keep this in mind and really think about what this means. So anxiety in general can be characterized as an overestimation of danger and an underestimation of your ability to cope with that danger. Okay, so let's say that again. It can be categorized as an overestimation of danger and an underestimation with your ability to cope with that danger, okay? So I don't have statistics on how anxiety disorders present amongst different ethnic populations. Again, that was too much, but I did want to get some of that in here because I think it's so important to always identify cultural factors when we're talking about, especially about mental health. But unfortunately, I don't have that in this little discussion today. So let's get into the types of anxiety. We're going to begin with generalized anxiety disorder. The reason we are beginning with this is because it is the number one most common anxiety disorder. Generalized anxiety disorder, or GAD, is a constant and intense feeling of anxiety regarding anything. So it's not specified to one specific thing, like speaking in front of a group, or driving over a bridge, or having to be in a small group discussion in class. This is generalized, okay? So it's regarding anything. And it's characterized by excessive worrying, okay? So you're constantly struggling with trying to control your worries. Now let's think of it sort of on a spectrum, okay? Just because you worry a little bit doesn't mean that you don't have generalized anxiety disorder. So keep listening here as I continue on with what it looks like. So oftentimes people with generalized anxiety disorder anticipate some sort of disaster despite any lack of evidence. So these are the people who always assume that something's going to go wrong, and I'm not talking about people who are just pessimistic by nature. These are people who constantly worry if something goes on or something might happen. Now, this might remind you of your mother or your grandmother or another family member that always says, "Oh, be careful," or "Call me when you get home. I want to know that you made it home safe." Or, you really shouldn't be doing that. Something bad could happen. You don't know what could happen out there. So those types of warnings, okay? Now, some of those are normal, right? Of course they are. We've all said things like that. Be careful, watch out, especially to our young children or a toddler as they're learning to get into things, and you say, "You better be careful, you can get hurt." Now, that's quite normal, right? But we're thinking about people who often embody this type of thinking, okay? Now, generalized anxiety disorder is diagnosed when a person finds it difficult to control their worries more days than not, okay, for at least 6 months. Okay, so there's the DSM, the Diagnostic Statistical Manual of Mental Health Disorders. I don't have it with me, it's in my office, but I wanted it to go over these, but Oh well, here we are. So there are specific symptoms that have to do with excessive worrying, that have to do with a generalized idea of worrying. So nothing specific, but you're just a worrywart. There's that term, and let's say people call you that. So it's important to note that generalized anxiety disorder is different from worrying that might be a specific thing to a set stressor. Let's say a loved one goes into the hospital and you don't know their diagnosis and they're sick. Of course you're going to worry about them. Of course it's going to tear you up inside. That's a specific stressor. Or you're going through a divorce and you're worrying about what will happen to your children and how is this going to affect our children? How am I going to pay my bills? That is all normal because it is a specific stressor. But generalized anxiety disorder goes beyond that. And those stressors are usually time limited, right? You know, the divorce ends, you get settled in, you start making, you're paying your bills, you're working, and so those worries kind of taper off. Generalized anxiety disorder is a lot more broad and longer lasting. Now, believe it or not, it affects 6.8 million adults in the U.S. population in any given year. 6.8 million people. Women are twice as likely to have generalized anxiety disorder, and the disorder comes on gradually and can begin across the life cycle, though the risk is highest between childhood and middle age. Let's talk about that in childhood. Generalized anxiety disorder can be learned. So if your parent is a worrywart, if your parent is constantly worrying and being vocal about those worries, that is sending a message to you that the world is unsafe and that you should be worrying too. So it is not unusual that if you have GAD, that your parent, one of your main caregivers, also has it too. It's not unusual at all. So something to think about. And then, of course, through adolescence and young adulthood, it may come as well. Middle age, it could really develop once your children are older and being a little bit more independent, and you're constantly worrying about their safety and them being out in the real world, going to school, etc. Now, keep in mind that worrying is a natural part of parenthood, and I do not want to pathologize that because it is a natural part of being a parent. And I'm sure many of you parents will say, yes, of course it is. So GAD is more severe than that, okay? So although the exact causes aren't known of GAD, there are some biological factors. So if you were exposed in utero, so that means when you were in your mother's womb, if your mother had an extremely stressful pregnancy or things in her life were unpredictable and stressful, that means her cortisol levels, the stress hormone, were fluctuating all the time. When that happens, you as the fetus or baby experience the same thing. When there are fluctuations in cortisol and adrenaline over a prolonged period of time, it can influence the biology of the baby. So there's biological factors, there's family background, so like having a parent who has something like that, and life experiences, particular stressful ones. If you've had multiple stressful experiences in life over and over again, then of course you might develop generalized anxiety disorder because stress is all you know, and so it really becomes ingrained in your mind as well. Sometimes just the thought of getting through the day produces anxiety for some people with this more severe. And people with GAD don't know how to stop the worry cycle and feel that it's beyond their control. And I will say that a lot of researchers say that no, worrying is not beyond your control. And in fact, it's a thought that you can control. All anxiety disorders may relate to a difficulty tolerating uncertainty, okay? So anxiety all stems from being unable to sit in uncertainty. In fact, let me tell you three main things. Three components of anxiety in general is an intolerance of uncertainty, over-responsibility, a sense of over-responsibility, okay? And the third is the inability, your inability to cope. Like you don't think that you'll be able to cope, like I mentioned earlier. And perfectionism plays in there as well. Okay, if you have a tendency to perfectionism, you're going to be a lot more likely to experience some sort of anxious distress. There's a lot to do with control, that we have this over sense of control, right? If we're anxious, we think we have more control than we actually do in reality. Many people believe that worry prevents bad things from happening. Even if that's not a conscious awareness, sometimes we feel that by worrying, we're doing something about the potential bad thing. So we feel like we might be more prepared. If we've worried about it and the bad thing happens, well, we can say, well, I knew it, and we'll feel a little bit more protected because we felt we had more control over our emotional response to the trigger. Generalized anxiety disorder can often accompany stomach aches and headaches. Someone who has these types of somatic experiences regularly, you really want to think about their anxiety, okay? People who have those physical complaints. Sometimes it's easier for us to identify in the body something that's wrong, and we often overlook how we feel mentally and emotionally. Okay. Excuse me. Let's talk about social anxiety disorder. So, social anxiety disorder affects 15 million people, 6.8%. Now, people with this disorder, social anxiety disorder, I'm just noting the discrepancy between the statistic between social anxiety disorder and GAD, which GAD is the most common one. I'm pretty sure that this social anxiety disorder statistic is inaccurate. So, when social anxiety disorder, people have an intense fear of others judging them in social or performance situations. They're usually terrified of potential embarrassment or humiliation. Embarrassment and humiliation are at the core of social anxiety disorder. So this disorder can be super extreme to the point that it's inhibiting this person from socializing, dating, traveling, etc., working even. So again, I want to normalize that if you are about to give a speaking engagement, if you're about to speak, if you're about to give a presentation in front of your class or at your job, to feel nervous is normal. You might have sweaty palms, your mouth might feel a little bit dry, you might have a little racing heartbeat. That is normal. Social anxiety disorder goes beyond that, okay? To where people with this disorder will they will not do things because of the fear of embarrassment and humiliation. So they hold back in their lives among different scenarios, so social, travel, things like that, because of their fear. And this disorder is equally common among men and women. So sometimes people with social anxiety disorder, they might skip events that they're interested in, that they want to go to, but they might skip it because they don't want to feel awkward or uncomfortable. They might decide that you're not really interested in those events, that you start to really say, well, maybe I'm not really that into it, or yeah, it probably would have been dumb anyway. When the bottom line is that you're avoiding the situation due to the discomfort that it will bring you. Whenever as people with this who have appearances change, so a haircut, or you shaved your beard, or you got glasses, or you got surgery or something on your face, you're terrified to go out and see people. You may not expect anyone to want to be friends with you. You often have a million excuses as to why you don't date. So you really rationalize why you don't get out there and go date. That's just an example. And growing up, you thought constantly about other people's judgments, and you thought that fearing people's judgments or criticism was normal. So, social anxiety disorder can become very debilitating, very much so to where you're not leaving the house, you're not working in an actual facility. You might prefer to work from home over the computer, or you prefer jobs where you don't have to interact with a lot of people, so you might like data entry or something like that. You might feel extremely self-conscious just walking down the street to get a coffee. Okay, so that's just a little snippet of social anxiety disorder. And now we're going to transition into panic disorder. Okay, panic disorder is very vast, and I am not talking about an anxiety attack. So oftentimes we use the term anxiety attack and panic attack interchangeably, but they are different. And to be honest, the term anxiety attack is not recognized in the DSM or among clinicians. We know what you mean maybe when you say that, but it is not a clinical term like panic attack is. So panic disorder, okay, is different than a panic attack. Panic disorder it really develops when you experience panic attacks that appear out of nowhere and occur unexpectedly. So you're just driving in the car in traffic and bam, panic attack. Okay, the attacks are so intense that they create anxiety about experiencing them again. That is the core of panic disorder, that you've had a panic attack and now you have a fear of having one again. That is the core of panic disorder. Panic disorder affects about 2.7% of the population. Again, women are twice as likely to be afflicted with them than men. However, However, some researchers feel that the number of men who struggle with panic disorder is much higher, but they don't report it, and perhaps use substances like drinking or something in a social context to normalize it or to self-soothe. Oftentimes, panic disorder can coexist with depression. That's the same for all of these. But let's talk a little bit about an anxiety attack and a panic attack, okay? Because they are different, even though anxiety attack isn't really a term recognized, like I said. But let's cover it just because I know many of you have used that language, I'm sure. So let's clarify what it looks like between an anxiety attack or just anxiety or a severe panic attack. So an anxiety attack is an intense or extended period of feeling anxious, okay? So it is more severe than just the simple feeling of feeling a little anxiety, but it is less severe than a panic attack. So it can last anywhere up to minutes, to hours, or even days or weeks that you're having that intense, extended period of feeling really anxious, okay? It usually is okay, I had to change my card. Oh my gosh, what I'm blanking. My those things. I'm sorry. Okay. So, that is panic disorder in a nutshell, and the distinction between an anxiety attack and a panic attack. Following that is agoraphobia. Agoraphobia oftentimes corresponds directly with panic disorder. They usually go hand in hand, and I will explain why. So, when you have panic disorder, if you recall, I said that you have had a panic attack unexpectedly, and then you have a fear of that happening again. Agoraphobia comes into play when you start to avoid that scenario in which you had that original panic attack. That's how it starts. So if you are driving over the bridge and you're stuck in traffic and you have a panic attack, and that becomes your fear, and you start really being scared to drive in traffic, to drive over the bridge, and now you're afraid to drive to work because you've had this panic attack. Agoraphobia comes in when you say, I'm calling out sick today. Or when you say, I have to take a different route because I cannot drive over that bridge. So you begin to avoid the seemingly triggers that triggered your panic attack. Okay. Agoraphobia is often depicted inaccurately in the media. So when we think of agoraphobia, someone might say, oh yeah, it's a fear of open spaces, or it's those people who can't leave their home. But it is not just that. It goes way beyond. So the media depicts it very inaccurately. So agoraphobia does not necessarily involve a fear of leaving your home, but it is a type of anxiety disorder in which we fear or avoid places or situations where we might feel trapped, or we might feel that we will have a panic attack. Or we avoid places we might feel helpless, which leads into being trapped. The sensation or the worry about being trapped is cornerstone to agoraphobia. So, people with agoraphobia fear an actual or anticipated situation, such as public transport, being in open or closed spaces, standing in line, or being in a crowd where you feel like you won't be able to sift through the people to run out of the room quick enough, so you won't be able to escape. And like I said, agoraphobia often accompanies panic disorder. So in the DSM, there you have panic disorder with or without agoraphobia. Okay, so they come like they're that tight. So it can get so bad that where before you just didn't want to drive over the bridge, now you don't want to drive in traffic. So you avoid high traffic times. Well, now you don't even want to drive alone. And so you'll only be in the car if somebody else is driving. It is so important, and for those of you, if you have agoraphobia, it is so important that you get help ASAP, as soon as possible, because agoraphobia can get much worse if it's not treated, because you're inadvertently confirming your behavior, you're basically avoiding over and over and over again, and it makes it that much more difficult to overcome it. But you absolutely 110% can overcome agoraphobia with the right treatment. So that's agoraphobia. Think of it as a complication that often comes with panic disorder, where we want to avoid situations that we perceive will trigger us. Feeling trapped, feeling helpless. We might be embarrassed to not be able to leave the room. We might have a panic attack on the bus and everybody will see me have a panic attack, and that becomes the fear. Okay? Now transitioning over to specific phobias. I'm just going to quickly mention this. There's too many phobias to get into. This video is going to be so long. I don't even know if you're still with me. If you are, thank you so much. But talking about specific phobias, okay? So these could be situations, these could be objects, or even types of people, like clowns or something like that. Even if there is no threat or danger. So of course, spiders is a common one. Heights is a common one. You know, we all can feel intolerant of heights, and it's not a phobia, but a phobia goes beyond that. So phobias do not necessarily stem from a trauma involving the object in question. So if you don't like clowns, it doesn't mean that you had some traumatic experience in childhood with a clown. They usually develop suddenly and without obvious explanation. And phobias can be so severe that even simply thinking about the phobia can cause a panic attack or cause anxiety. Now, for phobias, there's something very specific called exposure therapy that you do, and it is extremely effective if it is done with a well-trained clinician, and if you are brave and willing to go there, then you absolutely can get treatment. Okay, now we're talking about what is now called illness anxiety disorder. So the DSM is on version 5. So it every so often we change the name of diagnosis based on research. We change the way we categorize disorders based on research and the changing of time. So illness anxiety disorder used to be called hypochondria. It is not that term anymore clinically, but often we're going to use it. We use it, you know, in society all the time. And someone will say, oh, I'm such a hypochondriac. Well, probably not, because illness anxiety disorder is a much more severe thing. With a lot of these things, oh, I'm so anxious, I'm so depressed, or oh, I feel suicidal today. You know, we use this language in such a normalized way, and oftentimes it takes away from the seriousness of what these really feel like for people who experience them. So it's something I encourage you to think about, that you know, in the world, and as we're talking and just the language we use, let's be mindful of these terminologies that we use, and in that way we sort of honor the people who truly suffer with these conditions to where they can't leave their house, or that, you know, things like that. So illness anxiety disorder, so like I said, it used to be called hypochondria. It also used to be called health anxiety disorder. These are people who worry excessively, okay? Who worry excessively about becoming ill or severely ill. So this is different than generalized anxiety disorder, where we just worry about whatever happening. Illness anxiety disorder is specific to your health, okay? So it can be so extreme that even after medical tests have been done and indicate that you're healthy, you won't believe it. You're still not convinced. They sometimes, people with this sometimes even believe normal sensations or even minor symptoms are signs of a severe illness. So oh my gosh, my elbow has been aching so badly for a couple weeks, no matter what I do. Oh, I think it might be bone cancer. I know I read that thing somewhere, and I think I might have cancer. So you see, they go from a small ache in a localized part of their body to a very extreme illness. So, and ironically, their anxiety regarding getting an illness can often make them feel physically sick. And so they might be feeling nausea or headaches, and it's hard to discern that it's because they're worrying so excessively versus an organic medical concern. Now, it is important that I mention people with chronic illness that often goes unseen in the medical field. For example, Lyme disease, fibromyalgia. these individuals with those very real, chronic fatigue syndrome is another one, those are real, I believe they are real diagnoses for individuals. However, oftentimes those people are sometimes just shorn off as having, oh, you're a hypochondriac, or you must have illness, anxiety disorder, because they're constantly complaining of physical pain, but tests might come back normal, or the medical doctors just ignore them. So it's important that if you are thinking of somebody in your life who might have this, but you say, oh yeah, they say they have fibromyalgia, or, they say they have Lyme disease, but I don't know. I wanted to do a disclaimer here and say that it's important we do not label people with this disorder who in fact do have chronic illness conditions that are very real for them, that the medical profession has struggled to validate. So illness anxiety disorder is, someone who's constantly thinking that the worst is going to happen, health related, okay? So I'm getting headaches, oh my God, it must be a brain tumor. Or I think I'm going blind because I keep getting twitching in my left eye, or something like that. These are people who often, if you experience anything in your chest or any heart palpitations, and you go in and you get your EKG and you get all the test results and it comes back normal, and the doctors essentially say, nothing's wrong. These people will go home and look on Google or whatever to find illnesses that align with what their symptoms, they experience their symptoms are. Just like the other anxiety disorders, this is torment for them. Nobody likes to be in this position of constantly worrying and thinking you have somebody. Or have something. This is not attention-seeking behavior. This is not the more severe somatic disorders, which is a whole other thing. So this is not like Munchausen or Munchausen by proxy or anything like that. This is very, very different. This is an anxiety disorder, okay? Those are more severe personality things that I could make another video on, because that's sort of the abnormal psychology part of psychology, is personality disorders and those more severe things, which are really interesting to many people too. Okay, so the last anxiety component I wanted to mention is post-traumatic stress disorder, and PTSD is more likely to occur in women than men. Rape is the most likely trigger for PTSD. 65% of men and 45.9% of women who are raped will develop this disorder. So childhood sexual abuse is a strong predictor of a lifetime likelihood for developing PTSD. So I've told you two things, that the number one reason for cause for PTSD as a disorder is rape, both men and women. However, rape goes into childhood sexual abuse. If you were a child who was sexually abused, you have a stronger likelihood of having developed PTSD throughout your life, and this will show itself in very different ways as you get older. PTSD involves an extended period of extreme stress and fight or flight responses that occur repeatedly despite there being no stressor. For example, you have lived in an abusive household, you've been molested more than once, let's say from ages 6 to 12. So your fight or flight response goes through the roof every single time your abuser touches you or is even around you after the first incident, okay? So when that happens over time, it changes the biochemistry in the brain to where even if you're no longer around this person, the abuser, etc., you still have that fight or flight response in the absence of that stressor. Okay, so stimuli such as a car door slamming can trigger PTSD symptoms. That is a good example for veterans. We know that in the war that the U.S. had been a part of for so long, with our soldiers coming home from Afghanistan and Iraq, PTSD is the #1 complaint among all soldiers. In fact, there's been research done that PTSD is the highest from this war than ever before. Now, there's lots of reasons why we could go into that. That would be a whole other video. So things like a car door slamming or fireworks can absolutely trigger a stress response in the individual that can lead to very severe symptoms, flashbacks, etc. So sometimes people develop PTSD after, like I said, a sexual assault or a near-death situation, being in a car accident. Absolutely, you can have PTSD. Now, nearly losing their lives, if we're talking about soldiers and our veterans, think about how many moments of their time while they're on active duty do they fear they might nearly lose their life? Pretty much every single moment in many ways, right? The unpredictability. So the adrenaline, the fight or flight response is at its highest all the time, over and over and over again. A lot of our first responders, police officers, and firefighters, similar thing. They also have rates of PTSD. This is why we often find excessive alcohol use pretty common among police officers and firefighters as well. And that's because of their exposure to these near-death experiences over and over and over again as part of their daily career. So, in order to be diagnosed, there's several symptoms that have to be present. A big one is having flashbacks, or dreams where the event is you dream about the event frequently, things like that. I'm not going to go all into that. However, if you suspect you have PTSD, you probably do, but you would need to think about, do some more research, and I hope you would speak with your therapist about that. PTSD, I want to mention as well. If you lived in a neighborhood that's highly violent with a lot of gang violence or environmental factors, so people who are of lower socioeconomic status, we know are often overlooked by our institutions, and they endure environmental stressors. If you have been raised in that environment, it is not unusual for you yourself to also have PTSD as well. Okay. So for the purpose of this video, I did not include the obsessive compulsive disorders. They are now their own category. They used to be categorized as an anxiety disorder, but now they're their own. So I didn't include those for the sake of time. So I just want to reiterate, if we conceptualize anxiety as a continuum, okay? So not these anxiety disorders, but the term anxiety. Remember, all of us will experience anxiety at some point in our life, and we can think about it on a continuum that ranges from high calmness, where we're very calm and grounded in life, all the way to high anxiety, okay? And that's where we want to think about our life on that spectrum. So we don't want to over-pathologize our normal experiences, our normal human conditions, okay? However, if you suspect that you have something more severe, like an actual anxiety disorder, I strongly encourage you to get help. So I'm going to briefly mention the treatment for these things, okay? And I'm mentioning ones, like I said, that have been researched and that are evidence-based. So the first one is CBT, Cognitive Behavioral Therapy. This is well established, it's extremely effective, and it's lasting treatment. So it changes the way you think because you focus on your thoughts, your feelings, and your behaviors, and how all three of those things intertwine to create our reality. So participating in CBT has you to focus on identifying and understanding and changing your thought and behavior patterns. Usually benefits are seen between 12 to 16 weeks, depending on the individual, depending on the disorder, how severe, how long have you lived with it untreated, etc. This therapy requires you to be actively involved in your own recovery. You have to take on a sense of control over your wellness, and you absolutely will learn skills that you continue to use throughout life. So usually CBT includes reading about the problem, keeping records about your thoughts and behaviors between appointments. So you need to do a lot of homework in this way, and completing assignments they might give you. So you learn skills during therapy, but you also have to practice them in daily life over and over again for you to improve. And I will tell you, I am not a CBT clinician. I have received CBT, and it has been the most effective therapy I have ever done. And I can do a whole video about that. And I've done different types, but it has been the most targeted and effective treatment, where I noticed right away after 4 weeks, so 4 sessions, and a decrease in my symptoms. So then there's acceptance and commitment therapy. It's similar to CBT. It's called ACT or ACT, as acceptance and commitment therapy. This uses strategies of acceptance and mindfulness. So living in the moment and experiencing things without judgment. That's the key piece here, along with a commitment and behavior change as a way to cope with these unwanted thoughts, feelings, or sensations, okay? So ACT imparts skills to accept these experiences, to place them in a different context than how we first perceive them, and for us to develop a greater clarity about our personal values and how we want to commit to what behavior to make us live a life that aligns more with our values. Then you have DBT, dialectical behavioral therapy. This is really effective for individuals with borderline personality disorder. And this is integrating cognitive behavioral techniques, so CBT, but also components of Eastern meditation. This type of therapy combines acceptance and change. So DBT also involves individual and group therapy to learn mindfulness, as well as skills for interpersonal effectiveness, tolerating distress, and regulating our emotions. So DBT can be really helpful for anxiety depending on the disorder, and it is also helpful for personality disorders like borderline personality disorder, and the group component is a huge piece of DBT. Now, lastly, I'm mentioning eye movement desensitization and reprocessing, EMDR. This is most effective with people who suffer from PTSD. However, the more severe anxiety disorders as well would benefit from EMDR. And let me tell you, this is fascinating stuff, people. Very fascinating. So under certain conditions, eye movements appear to reduce the intensity of disturbing thoughts. Simply moving your eyes in a certain way reduces the intensity of disturbing thoughts. This treatment seems to have direct effect on the way the brain processes information. So it basically helps us to see the disturbing material in a less distressing way. So this type of treatment, it mimics what naturally occurs during our REM period of sleep, the rapid eye movement sleep, okay? You know REM, how oftentimes the eyes will shift back and forth when you're in a deep sleep. We might see this on movies, etc. It evokes the same exact thing. So it has, like I said, scientific research has pretty much said this is the most effective for PTSD, but also some clinicians have reported success with treating phobias and panic disorder. So a little bit more severe of the anxiety disorders. So all in all, I don't even know if you're still with me on this little psych chat lecture. I am genuinely interested in your feedback, so please leave a comment letting me know what you thought. Did this spark any questions for you, or have you experienced any of this, and what did you think about what I said? Now, I have to again do a disclaimer that I basically flew over these disorders. I did not have the amount of time to go into depth on these disorders the way I would like. And so if I get feedback that this is really interesting, I will make other videos where I can go much more in depth and do case studies and things like that to illustrate. So I'm so glad that you joined me. And I will be doing more of these. The next one is probably going to be on grief and loss, and I will actually be describing my own personal experience to illustrate how grief and loss affects us through the lifetime. Okay, so anyway, please let me know what you thought, and thank you so much for joining me, and I will see you next time. Bye-bye.